Welcome to the Red Beard Embodiment Podcast. I am your host, Alex Green, and I'm on a mission to bring the power of embodiment to people all around the world. In this podcast, we explore how embodiment practices, trauma healing, and knowledge about the human nervous system can help us find our ground, discover new sources of meaning, and create connection in an ever-changing world. The deepest change is embodied change. All right. Good morning and afternoon, everybody. I am excited to be sitting down today with Christine Schneider. And I'm in Boulder, Colorado, as always. And Christine is in the Poconos in Pennsylvania, just outside of New York City. And super excited to talk with Christine. I was on her podcast a month or two ago. She has a very wonderful podcast called The Visceral Voice, which we'll be speaking about. But let me give you just a little short introduction to the wide world of Christine Schneider. Christine, she's been a pioneer in manual laryngeal therapy in the U.S. for almost a decade. She's the founder of Lifelight Massage Therapy, which is a private practice based in New York City that specializes in laryngeal and TMJ treatments for professional voice users. She works closely with some of New York's top laryngologists, speech pathologists, and voice teachers, and provides manual therapy as part of vocal rehabilitation and maintenance programs. As I mentioned, she's also the creator of the Visceral Voice, which is an educational program and podcast that shares her knowledge and passion for vocal health, anatomy, self-massage, and movement with vocal athletes worldwide. Christine has innumerable specific trainings in voice, but just to name a few of those, she has training in tailored techniques and myofascial assessment and release, of which she's an educator and approved provider. She also has specializations in visceral components of the neck and thorax, visceral manipulation, which is something we've talked about on this podcast before, neuromeningeal manipulation from the Barral Institute. Barral Institute is the teaching institute for visceral manipulation generally, and specific work with whiplash and related disorders, as well as craniosacral therapy. So there's more than that. Her educational background is in professional voice work herself as a vocal performer, as well as French horn. Movement education fits into all of this. Strength training education fits into this. What other titles? LMT, so massage therapist, voice specialist, certified movement specialist, and personal trainer. So these are the, when I met Christine, I thought, oh, cool. Somebody who also, didn't just sort of be interested in her career. No, she dove in deep and has got, just to share quickly, Christine, I'm so interested. I've been excited about this conversation because I want to hear all the geeky, nerdy stuff about bodies and voices. And I know very little about that. That hasn't been a specialization for my manual therapy at all, although I've seen that stuff. But voice is such a cool thing for me. And in the podcast recording you and I did, we talked about how voice is so important from a nervous system perspective. And so we were kind of coming at it from that lens. And I don't have vocal training in a musical sense, but in my Buddhist training, the chanting work we did was very vocal and very embodied. And so there's ways in which I've had a little bit of exposure to how does my body produce sound and resonance has been just sort of an interest of mine. So with all that being said, Christine, welcome to the Red Beard Embodiment Podcast.
Thank you, Alex. Thank you for having me. And you can tell that you have had some vocal training just by hearing your luscious voice on the microphone. So.
Oh, good. Oh, okay. We'll get an analysis here. This is great. Live analysis. We'll have callers call in, and we can hear what Christine's discerning ear can pick up. That's awesome. Well, Christine, could we? I like to just sort of go into background first. Just you obviously were interested in music and performance, and somehow this you steered in the very specific specialization, areas of specialization you have now. And I'd kind of just love to hear that story. How did you end up here?
Yeah, sure. Thank you. I started off as a young singer. So as you mentioned, I sang when I was a younger child and I played French horn and I double majored in both. I have a degree in both vocal performance and French horn performance with a minor in piano. Because when
Right.
you get a voice degree, you have to minor in piano. And when I was in a huge beginning to this for me, or really I would say the beginning of this for me, was when I was in high school. And it starts when I was in 8th grade. I was in a car accident and I already had pectus excavatum. I was born with a concavity of my sternum.
Yeah.
And
Can you linger there just for a second? Because
sure.
I happen to know what that is, but could you just elaborate for a moment on that for listeners?
Yeah. So pectus excavatum is when there's a concavity of the chest wall or of the sternum. So the chest kind of has an indentation in the middle. It is more common in young boys than it is in girls. But obviously it can happen. It happened to me. And sometimes that someone can grow out of it with breath work. I've even seen some of my friends or colleagues as adults grow out of it through breath work. And a lot of the practice I do now actually is around the idea of pectus excavatum and around asymmetry. And so it's interesting. I wish that I had known a physical therapist back when I was going through it that knew more about it than
Right.
I didn't know anyone at the time that knew about it. And I wasn't actually given any form of physical therapy or rehab at all after. So I ended up having a major thoracic surgery. After the accident, my sternum had rotated over 2 years to the right.
I see.
So I had a 90-degree sternal rotation and my right ribs were coming in toward the heart. The left ribs were coming out. And then the xiphoid process had already begun to puncture one of my lungs.
Wow.
So I had this kind of, I always refer to it as a tourniquet happening within my thoracic cage.
Yeah.
And I finally was able to have surgery. And that took a long time to, one, diagnose it, and then to actually find the surgeons who were able to do the surgery. And so they removed 4 inches of 12 ribs. They had to wire and rotate the sternum back 90 degrees. And then they had to completely remove the xiphoid process. So, and then they said, okay, and now you have to relearn how to breathe. But there was no training in relearning how to breathe. So I had already, that was 2.5 years coming to finding the surgeons. And I mean, by this point I was dying. I was very lucky to find who could help me. It was actually through an acquaintance at school who said, I think I know what's going on with you. And then my school nurse actually got me into surgery 2 weeks earlier than I should have.
Right.
So
What age? What age were you at this point again?
Yeah, at this point when I had my surgery, I was almost 16.
Okay.
So I was 15 and a half.
High school. Yeah. Yeah. Okay.
Yeah, I was in high school. And then I just kind of was left to my own devices on trying to figure out how it all works after that. Because I didn't have protection of the heart, so I wasn't able to be, nobody could touch me. I couldn't have any kind of touch for a while because of the, just the fact that the heart wasn't protected by the ribs as the costal cartilage grows back when you're in that age, which is just amazing to me because once you start learning about cartilage and you're like, cartilage doesn't
usually grow. I tore my meniscus at one point. I don't think it's grown back. Yeah.
Yeah. Yeah. And so the costal cartilage grows back and did. And so it made me incredibly in awe of the human body. Right. And I continued on with my music training. And as I started getting more and more professional, I started getting more and more performance anxiety, because my body didn't know how to breathe. And various music directors would say, Christine, you have to breathe. and to which it would just throw my nervous system into some PTSD. It would make me feel like I don't know how to do that.
Right.
And so I mean, I had a wonderful performing career that I'm super grateful for. I
Hmm.
had met a massage therapist in Colorado. I grew up in Colorado, and I met a massage therapist in Colorado who he had a lot of TMJ therapy training, and he would just work around this whole area. And my singing was spot on. It was coordinated. It was healthy. And when I moved to New York City and no longer had that body work in my life,
Mm.
I searched for bodywork practitioner after bodywork practitioner. I couldn't find anyone who had any kind of knowledge or information about the voice and about what we need as voice users.
Mm.
And I was trying to convince other people, hey, you know what you should do? You should become a manual therapist for singers. And people would say, yeah, no, that's not for me, but it sounds cool. We definitely need it, you know? And then finally I thought, okay, you know what? I guess I was in between contracts and I thought, I guess this is supposed to be me. So I signed
Oh,
up
wow.
for massage
Interesting.
school without telling anybody. The only person I told was my agent. And I
Wow.
hadn't told my family, I hadn't told my friends. And then once I was signed up for school, then I started telling everyone. And I left school to do a contract, and then I came back. And then as soon as I finished school, I went directly into a contract for 3 years, which I met my husband in. So I was
Mm.
able to build my practice, which I've had now. I started my private practice in 2011.
Mm.
So almost
Yeah.
13 years
12,
ago.
13 years. Yeah. Yeah. Yeah.
Yeah.
Yep.
Yeah, and I was so fortunate because I was able to practice on my castmates and just keep learning. And then they loved it and they'd start telling everyone. And so literally within a year, I had a full-time practice because no one else was
Wow.
doing it.
Wow. Wow. That is so cool. So I love how you went to, that the whole vision came first and then the how to do it, get the manual therapy, get the massage license and all of that. When you were in school, did you tell people, hey, you kind of knew where you were headed in terms of a focus?
This is such a good question. My colleague, like my friends in class, definitely knew.
Mhm.
My business class, the only business class I've ever had, which I can't believe as a performer we don't have business class because you're in business for yourself, which
Right.
is crazy. But the only business class I've ever had was, I don't even know, like a 10 class in my massage program.
Right.
And I had to write programming for a demographic.
Uh-huh.
And so I wrote the programming for the professional vocal athlete
Right.
demographic. And my teacher called me up and said, this is not a big enough demographic. You have to rewrite this paper. So I had to I was also a long distance runner at the time. So
Right.
I rewrote it for long distance runners, but
Got it.
I had to rewrite my paper because they said
Okay.
it was
All
not
right.
a big enough
Let's
demographic.
look up that teacher's name and email her a link to this podcast episode. So she, um, that is wonderful. Wow. Okay. So you launched. You had and and within a year you were doing it. So yeah. So you're using a term that is probably common sense to you, but I've never thought of it all that much. But vocal athlete, is there something? Is a what's included under the umbrella? What do you consider a vocal athlete?
Yeah, great question. Anyone who uses their voice professionally, and it's far more of us than we actually recognize.
Mm.
So, of course, my private practice is in New York City, so I'm
Mm.
working with the stars of Broadway, the stars at the Metropolitan Opera. I'm working with sports broadcasters from all
Mm.
around the world. I
Mm.
work with audiobook narrators.
Mm.
I work with fitness instructors. I
Mm.
work with lawyers. I work with teachers. Now, of course, my work is predominantly the Broadway Met, sports broadcasters, audiobook
Mhm.
narrators,
Mhm.
just because I'm trying to help people continue their work. But if you're a teacher, if you're anyone that's using their voice a lot for several
Mhm.
hours a day, any kind of job that I've seen nurses who have to use different recording devices for 8 hours a day recording into them.
Mm-hmm.
That's a professional vocal athlete, or at least that's a professional voice user.
Mm-hmm.
And then I would even go to say that that's a professional vocal athlete. You have to
Mm-hmm.
know how to use your voice if you're going to use it for several hours a day.
Right.
And many people don't think about their voice until something happens to it.
Super interesting. Okay. So can we talk about, I mean, you're already talking about, can we talk more about, because there's a few dimensions to your work. You've got your one-on-one private practice. I think you told me you're in your second season of supporting the Metropolitan Opera youth singers or something like that, doing movement and vocal work. So that's kind of group work. You've got your educational platforms, which we're going to talk about. There's probably a few other things in your what you do, but can we start with your one-on-one work? Because I'd like to just sort of like, you're naming the people. I'm getting that, the broadcasters, the singers, the performers, the heavy users of voice.
Mm-hmm.
I'd love to hear a little bit about, I guess first, what are the common situations that bring people to you? What are they,
Mm-hmm.
what's not working, or what ailments are happening that somebody recognizes, ooh, I need some support.
Mm-hmm.
What are those situations?
Yeah, so my private practice is Lifelight Massage Therapy, and that is my private practice in New York. And I have some associates now who work with me as well.
Right.
And we either have these professional vocal athletes who are doing such intense amounts of voice use, like 8 shows a week on Broadway, plus, a lot of times they have rehearsals on top of that. Plus they have benefit concerts or various different concerts. Plus they have, maybe they're recording an audiobook at the same time. The roles that they're doing are really demanding. That's a lot of voice use. And for many of them, I'm actually providing maintenance care. So I'm just part of the team that help them to successfully get from week to week. And then, of course, if they start experiencing vocal fatigue or hoarseness or anything like that, then we kind of transition into maybe seeing them a little more often, maybe something else. Now, vocal athletes, it has been only in probably in about the last 10 years. I myself, as well as several colleagues, have been fighting for a lot of these vocal athletes because it's not uncommon for a vocal athlete to get a vocal pathology. And in any other field that we see that happening.
Sure.
And it hasn't been, shame on you or something's wrong with you, or, it's overuse. You're using something a lot. Right. And so the more care you have and the more preventative care you have to help that not happen, or have a team behind you for when it starts, it's like, oh gosh, I'm overusing this. Let me prevent any kind of injury is a big deal. And that is true of the voice as well. So part of that is the maintenance work that we're helping so that these amazing artists don't get injured. Then we have the rehabilitation of when someone does get injured. That could be anything from an actual vocal cord pathology, like vocal nodules, polyps, cyst, pseudocyst. Maybe they were born with something like a sulcus, any hemorrhage, muscle tension dysphonia, paresis, anything along that line. I'm helping with the rehabilitation. I am the practitioner who sees the very severe cases, and it might not be, this is where I branch out, where it's not necessarily a vocal athlete, but someone who has major swallowing or phonatory distress based on direct trauma. So I've seen someone with martial arts injury from a chokehold. I've seen someone from a basketball injury from getting hit in the throat. I've seen someone from a volleyball injury. I've seen someone with a broken hyoid bone, someone with a broken thyroid cartilage. So I've seen the direct severe traumas is what I'm working with myself, as well as some of the like really elite vocal athletes.
Right. Right.
where you're signing the, you know, NDAs. And then a
Right.
lot of my associates are helping kind of with more of the maintenance work of artists. But if it's kind of the
Yeah.
trauma, then it's
Yeah,
often me who's
physical
working with them.
trauma. Yeah. Okay. Interesting. So on the maintenance side, sort of, preventative maintenance, no injury has yet occurred. What what's included in that? I mean, is that manual work? Is that, I sort of have my imagination of, vocal people doing vocal, singing exercises and warming up properly and stuff like that. But in terms of your private practice work,
Mhm.
what are some of the maintenance components that supports just prevent that nothing minimizing the likelihood that an overuse injury is happening. Yeah.
Yeah. One, we really try to emphasize, and now I'm usually on a team with a voice teacher, sometimes a speech therapist, an otolaryngologist or a
Hmm.
laryngologist. So I'm on a team. And so someone else is working with the technique of their voice. And then
Hmm.
I'm working with how is everything functioning together. So
Right.
people hear laryngeal and TMJ therapies and everything, but we are all also we do medical massage.
Right.
So we are looking at the whole person and seeing, I mean, it's, as you know, everything is very connected, and something that's
Sure.
happening around the voice could be maybe someone had a C-section that's impacting their intrinsic stabilization system and they're not able to breathe, and then they have too much subglottal pressure.
Right.
So maybe it's been some kind of abdominal surgery that threw things off. Maybe it's that all of a sudden they're having to wear 6-inch heels in a show, or they're on a rake stage,
Mm.
and that totally throws off and tips their system where their body isn't entirely sure how to manage pressure.
Mm.
So I look predominantly at the fact that I'm helping someone learn how to more optimally manage their pressure.
Hmm.
Because that is what the human body is a pressure system. And when we're
Right.
looking at something with too much force coming underneath the vocal cords, then we're just not managing pressure well yet.
Hmm.
So, or we've kind of lost the ability to do that. So I am looking whole body, and then I kind of zone in. I do give movement drills based
Hmm.
on what I'm seeing. So
Hmm.
we'll work on them in clinic, and then I send them home with these drills. And then I
Hmm.
do hands-on based on different patterning that I'm seeing based on what they've experienced. Some of that is to help open them up and kind of realign C3 to C6 right at that hyolaryngeal complex
Hmm.
area. So if
Yeah.
the cervical spine is in a different position, that's going to impact the laryngeal musculature. I'm interested in what's happening with the jaw, what's happening with the hypopharynx. So the positioning of the hypopharynx, or the lowest part of the throat,
Uh-huh.
and very interested in what's happening with the rib cage.
Totally. Okay, super cool. So for somebody who hasn't had, uh, VM, visceral manipulation style, or craniosacral, or myofascial release, these styles of bodywork manual therapy, I'm assuming some of what you're talking about, some of the support is through the manual therapy. Could you describe to somebody who hasn't had that kind of work, what it feels like, how does touch and like, a layperson might say, well, how can your hands support my hyoid, or how, or can you just describe that a little bit, because I think it's
Yeah.
a cool area. Yeah.
Yeah. I think two of the things that I know about manual therapy is that, one, it helps to increase circulation, and
Mm.
two, it helps draw our own brain's awareness to the area.
Mm.
And that's exactly what we're doing. It is surprising for people to feel how gentle the pressure is, especially when I'm working around the larynx. Part of what I really appreciate from all of the education I had at the Brawl Institute with both visceral manipulation and neuromeningeal manipulation, and with the Upledger Institute with cranial sacral therapy, is one, that gentler approach. But the Brawl Institute really teaches listening and really teaches direction of ease,
Hmm.
which made so much sense to me, especially working with their nervous system. I do not view myself as manipulating tissue, and I do not view myself as a healer. I
Hmm.
think all of our own bodies have the ability to do um, the
Reorganization.
reorganization that it needs to. We're just helping to facilitate it. We're just saying, hey, where do you need to go?
Mm.
And so that's what I'm interested in doing, is coming
Mm.
into tissue and saying, where does this tissue want to go? Or tissue, where do you want to go? And
Hmm.
then it goes in that direction, which is considered the direction of ease. And then we just kind of let their own nervous system come in and recalibrate where that is, and then it lets go and brings it back to a neutral, and then we can bring it into more of a direction of a stretch.
Right.
So I think, as opposed to, kneading tissue, and everyone thinks of massage as like coming in
Right.
and kneading the tissue and manipulating it and moving it all about, that's not the kind of work that I do now.
Yeah.
It's very much that follow the tissue and then let the body reorganize itself.
Wonderful. We have a therapist on our team in our Madison place who's really, who maybe I'll put her in touch with you, actually, because
Yeah.
she's done VM for a long time, and she's really getting interested in throat vocal kinds of work. And anyway,
Cool. I have a lot
super
to
cool.
learn from her too. I mean, I've done all of their training up through some of their advanced
Yeah.
classes, but I don't implement all of visceral manipulation. So
Yeah.
luckily, my colleague Peter Capola moved close. He's in Connecticut.
Mm.
And so if I feel like someone should be getting, or we'll co-treat a lot too,
Sure.
where I'm like, this person needs
Nice.
visceral manipulation.
Yeah.
I mean, like abdominal visceral manipulation.
Right.
I'm pretty
Right.
comfortable with thoracic. I'm comfortable with laryngeal,
Yeah.
anything along cranial, intraoral.
Yeah.
But if someone's needing abdominal, I just go ahead and
Yeah. You
I just
co-treat.
collaborate. Yeah,
Perfect.
I'm like,
Yeah.
I
Great.
can't specialize in all of that too.
No, good way to do it. Okay, can we talk about pressure systems for a minute? Because I love
Yeah.
that idea that the human organism manages pressure. That makes sense to me. And I'm thinking, and I want to hear a little bit more about that, and how, and ways that we can influence that. Yeah. Start with you. I've got a couple of thoughts of my, curiosities of my own, but yeah, just give
Yeah.
us. Can you just speak to that a little bit more? This idea of the pressure system that you refer to.
Sure. I mean, when we're talking about the pressure system, we're talking about the human body. So it doesn't matter if a person is a singer or not.
Right.
You are dealing with a pressure system when working. And that's all movement is working with the pressure system, and all strength training is working with the pressure system. So when I'm talking about pressures, I'll like briefly touch on. So if I'm talking about intra-abdominal pressure or our gut pressure, we have 6 structures within this intrinsic stabilization system that's helping to build and manage our gut pressure. We have intrathoracic pressures. So we have an intrapulmonary pressure, we have intrapleural pressure, and that's what's helping. And then we have barometric pressure outside of us, and that's what's helping to decipher when we're expanding the lungs and drawing in air or letting air out. That's all a pressure system. And we have subglottal pressure or subglottic pressure. So underneath the glottis is the space in between the vocal cords. So that space, that is called the glottis. And so we have below the glottis pressure, we can have supraglottic pressure. So a lot of how to manage and work with some subglottic pressure is training of the intra-abdominal pressure and doing some supraglottic, and we call those semi-occluded vocal tract exercises, are this kind of supraglottic pressure where it can kind of reorganize how the vocal cords are coming together, so how they're coming into adduction. And then we have intracranial pressures, and these all have a relationship and a response.
Interrelationships, yeah. Oh my gosh, such a cool topic for me. And I'll tell you why, because, well, so first of all, one thing I like about this, we talk up, breathing a lot, and most people's just common sense view of breathing is pretty simplistic. Well, I breathe in, there's air in my lungs, and I breathe out, and there's less air in my lungs, which is true from, the gas involved is exchanging at the level of the lungs. But breath is such a more full-bodied process due to these interrelationships of interthoracic pressure, interabdominal pressure, cranial pressure, all. And the reason I'm sort of smiling is because you're speaking to something that to me is so important and intuitive. I don't even have a 1% of the sort of the language. And so I like how technically organized you are around it, where it really came, where it puts language to, when I mentioned, in my the chanting practice was one situation. And then in the same time period, I was doing a lot of Japanese martial arts training at the same place. It was sort of, and in both of those ways of training the body, there was a very big emphasis on the use of breath, and especially there was a very specific set of principles around managing pressure, and it had to do with the Japanese concept of hara, H-A-R-A, and which is referring to the area below the navel. And so there were sort of various practices around sustaining a certain degree of a consistency of pressure in that area. But not only there, how does that pressure relate to, and we didn't get technical in all of into what's going on, but at the experiential or felt level, those interrelationships were super important. So the nerd in me is just excited to hear that there's such good scientific language about these, distribution of pressure and stuff like that.
And it's how it impacts each. I mean, breath is movement.
Yeah.
It impacts all of our major joints. So I can go through it. You could always cut it if you want.
If
we're breathing, if we're inhaling, then we have, actually, if people think extension, but we actually come into a little bit of elongation and flexion of the spine.
Okay.
It's not like major flexion, but the spine flexes a little bit. Mm-hmm. The lower cervical come into a little flexion. The upper cervical come into extension.
Right.
Our pelvis, so our sacrum, comes into a little counter nutation. Our innominate bones, so our pelvic bones, come into some external rotation. Our femurs, our tibia, external rotation, all the way down into supination of the feet with our inhalation.
Right.
And then our exhalation, so the rib cage has expanded in that inhalation. Right. And then with our exhalation, as the rib cage starts to compress, we start to have, it's not extension, but it's relative extension from what has happened with the expansion of the ribs expanding posteriorly, which is why because there's counter nutation and that expansion in the back, we call that like spinal flexion. Mm-hmm. So relative extension on that exhale, and then we have some extension of the lower cervical, some flexion of the upper cervical. We have more of a nutated sacrum, internal rotation at the hip bones, internal rotation, femur, tibia, and then more of that pronation down at the feet. So we can see how there's a direct and the reason it's impacting all the way down to the feet is because of how related our respiratory diaphragm is with our pelvic diaphragm, so our pelvic floor, and what's happening upon breath. Now, interestingly, my very good colleague, Eliza Radofsky, she and I are creating a manual therapy class together for laryngeal therapy. She's a physical therapist, and she does research with pelvic floor. And before, we're thinking that it's a piston and it's moving together and it's always moving together. Right. Well, that's true upon rest, but it changes when we actually move into voicing. And when we're moving into voicing, and I have an episode with her on the Visceral Voice podcast, if people want to hear more. She's really brilliant and her research is wonderful. Great. But what she's seeing is actually that this is kind of happening, which makes a lot of sense.
Elongation or something. Yeah.
Yeah. Like as we speak,
supporting voice, there's a lengthening of that axis. Yeah. Okay.
Which makes sense because we have more abdominal support coming in. So if we think of it a balloon and we have anterior, posterior, so front, back, AP compression, the balloon is going to go like this.
Yep.
Yeah.
Yeah.
And that's what that's pretty much what we're seeing or what she's seeing when we are coming into voicing, where there's not as much abdominal contraction per se when we're not voicing. And so the respiratory diaphragm and the pelvic diaphragm are kind of moving together. Anyway, all of that's very controversial and her research is incredible. And we're very excited to, I kind of let her share that, but I'll mention her brilliance and she could probably, I don't know, hopefully I've described it accurately.
Nice.
If not, I'll have her write you and tell you what is accurate.
Okay, well, we'll link to that episode. That sounds great.
But the pelvic diaphragm, its relationship, it is in the intrinsic stabilization subsystem. The respiratory diaphragm is at the top of that system, 6 structures, and the pelvic diaphragm is at the bottom. And how that pelvic diaphragm impacts at our pelvis, and then how that impacts all the way down to the feet. So it's this relationship of our transverse tissues, our diaphragms, that have this direct relationship all the way down to the feet. So even when we're talking about something with the voice, and I have someone say, I have plantar fasciitis, and I had an ankle break, and I have this, that, all the way down at the feet. And it's like, that's not related though, right? And I'm like, yeah, that is, with what I'm seeing up the chain, that's probably related.
Yeah. Oh, fascinating. Okay. So then well, let's use the opera the youth opera singers you're working with. And from our discussion, it sounded like primarily you're supporting through movement education, maybe less of the manual therapy, or maybe both. I'm not sure, but maybe can you speak to how you approach with them? Is this maintenance work or what are your goals with working with that population?
Yeah, so I am the movement coach for the Lindemann Young Artist Development Program. So these aren't these are adults, and they're anywhere from, I don't know the age range, probably 24 to 32. They're young opera singers who are amazing and have incredible potential, and they're kind of getting ready to go into a phenomenal opera career.
Okay.
And so they're already at the most elite level. They're already performing at the Metropolitan Opera. They're already performing at most of the main opera houses around the world.
Right.
And it's just to kind of give them a little extra training for what they need. So I'm actually paired. I work alongside my colleague, Matt Cahill, and Matt does the Alexander technique there. And then I do the movement coaching. So I do predominantly movement with them, helping to learn how to strength train in a way that is most optimal for the voice. We can't continue to add compressive load onto a singer, because if that compression starts impacting the rib cage, which it does, and we don't have the ability to continue to have shape change within the rib cage and that expansion that's required, then the voice, then we're messing with a pressure system that can't function to that elite level. So how we strength train an elite operatic singer is very specific. It has to be really specific work, and traditional training they can't just follow standard strength training practices without risking compromising their elite acoustic qualities, something like that. And maybe at 24 that'll work, and maybe at 30 that'll work, but at 40, 45, I mean, why? The reason I'm there is, even though young artists don't necessarily like to slow down and come into some of the detailed work, some of them love it. But when you're already a very busy person, you want to keep things moving, which I was the same way. I do not fault them at all. But when everything's working, it's like, okay, cool. I'm there. The reason I'm there is because I've seen what happens later. It's
Mm.
about giving them longevity and giving them information that they can carry with them for the rest of their lives as a professional elite singer, with
Uh-huh.
how should I train my movement to, one, continue to give longevity to my body. We know that we need load for our joints and our joint health,
Hmm.
but how can we do that in a way that's not going to negatively impact our singing, our voice use?
Got it. Wow. Sounds fascinating. Yeah. Yeah. I could imagine an entire episode on, I really like opera actually. I'm late to it in my, maybe, I don't know, this is maybe about 10 years ago. I had a friend who was just a huge opera buff, and she was and I had never had any interest, but she was so enthusiastic about it that it was infectious. And so I started going. You know how they do at some movie theaters, they'll do a simulcast of the Met Opera,
Mm-hmm.
like in a theater. So I think my first thing was I went and watched what is it called? Is it the Ring series of
Yeah.
Wagner?
Oh,
Yeah.
Wagner.
Yeah,
Okay.
yeah. So I went to those, and and she was so knowledgeable that I could just learn so many of the principles of the art form, both
Mm.
stylistically, but especially the embodiment. So I'm planting a seed for myself that I want to do a podcast episode specifically about the embodiment of opera singing. But
Yeah.
maybe
Yeah.
maybe I'll invite you back on if we could do that. But let's
Sure.
not go further on that at the moment. So, question for you. So uh so much of your focused in population, not exclusively, but a lot is, vocal athletes and or people who have, for whatever reason, physical trauma or some pathology. Um, but for people who don't consider themselves a vocal, definitely not a performer at a minimum, or even necessarily a inordinately heavy voice user, what have you learned through the course of your work that you think just what applies to anyone in terms of awarenesses around their own use of voice? Like, what's the kind of thing, that information that you think would be valuable for almost anyone to think about?
Yeah, I think the main ones I think we've touched on. I think the idea that breath is movement.
Mm,
And when someone's in an excruciating, if someone's had a major trauma and having nerve pain and having a hard time moving at the acute point, breathe, come to your
mm,
breath. You're
mm,
still moving. And I think that's a really important component. Looking at your body as a pressure system,
mm,
that is across the board. That's true for all of us, no matter what you do. Finding a nice stacked position. So I have 3 companies, and I think that's why it gets confusing. I have Lifelight, which is my private practice. I have Visceral Voice, which is my education platform and my podcast.
uh-huh.
So that's where I teach all of my anatomy and various courses. And
Right.
then I have Performance Movement Restoration, which I have a business partner, Chris Kelly,
Uh-huh.
and we teach voice users. It's for anyone, but professional voice users, voice teachers, private practitioners, anything, how to work more with focus and emphasis on the voice. And
Hmm.
at PMR, so
Yeah.
Performance Movement Restoration, at PMR, we refer to what's known as a stacked position. And that's your aligned position. And
Hmm.
alignment is always changed. Like
Dynamic
we are
alignment.
never, it's
Yeah.
dynamic alignment.
Yeah.
So if you're in your stacked position. And so I think it's also recognizing that when we come out and the body is asymmetrical, it comes into various different patterns. We also have morphology, which impacts different bodies, and how various patterns come into each body, kind of
Hmm.
moving in towards perhaps where someone might be more likely to get some kind of injury. And so all of that is in all human bodies, and how it will we actually can gain a lot of information through what's happening with our voice.
Hmm.
In fact, so I credit all of us voice users so much, because we actually a lot of times do prevent different injuries happening somewhere else, because we're so sensitive to what's happening around our voice that we almost are able to recognize things before they become
It's like
a greater problem.
canary in a coal mine situation. Like if you're sensitive enough to your voice, you might start to notice as something is awry. Is that kind of what you're saying?
Yeah, it is.
Yeah.
And how our neck positioning with text neck now, and we're all talking about what's happening with cervical disc herniations and breathing strategies and everything. But I mean, our hypopharynx it's starting to get compressed, and we start coming into everything gets constricted. We're almost in a positioning of mid swallow. We don't feel like we can have open airways. There's far more folks who are experiencing sleep apnea, stuff like sleep apnea, airway disorders, etc. And that's all related. That's all related. Swallowing issues, that's all related to what I'm talking about with the voice. So anything with, this is called the Stomatognathic System. So that's including the musculature of the jaw, the palate, the pharynx, so our throat. It involves the larynx, it involves our cranium, it involves our respiratory system, and that's all the Stomatognathic System. And how involved the Stomatognathic System is with the rest of the body it's profound. It's all connected. So whether you're a professional or consider yourself a professional voice user or not, we learn a lot from just gaining kind of information into this area, or drawing awareness and informing through this area.
Got it. Yeah, wonderful. So coming to the Visceral Voice itself, at first when I came to it, I thought it was a podcast, and I see it's big. It's a project. It's a company that's bigger than just a podcast. Although it's an excellent podcast. Could you just touch a little bit upon Visceral Voice? What it sounds like education is a big theme, and I see that there's some self-paced programs that are included. There may be some more experiential kinds of workshops or things. Can you just speak a little bit to what's included in the Visceral Voice platform?
Yeah, so it started as my podcast, and then during the pandemic, I started teaching a lot more. I created a self-care program, which is now 16 weeks. It used to be 6 months, and I've cut it down. And this is self-care of the whole body. It could be for anyone, but we do, I mean, a lot of speech therapists and voice teachers and voice users take the course, because we are getting, we'll do some cranial alignment and intraoral and TMJ and MTD, but we're also doing pelvis and lower leg and upper leg and acupressure rings and everything.
Right.
So that's a 16-week program. I am in the, I have, I think 5 self-paced programs I'm working on right now. They have not launched, but I'm working on a vocal cord dysfunction support program. There's experiential anatomy, which I teach with a phenomenal voice teacher in the city. We teach that usually once or twice a year, but I'm creating a self-paced for anyone who kind of wants it to do it in between those. I do a cylinder class, so really understanding the intrinsic stabilization subsystem and how to build and manage pressure how to build and manage our intra-abdominal pressure. I teach a course with another phenomenal voice teacher in New York City, and that's a 10-part class each year, and that is Anatomy Nerds, where we get into like crazy heady anatomy. Like if you want to really learn anatomy, Anatomy Nerds is for you. And it doesn't matter if you're a voice teacher or not. We are like really honing in on anatomy. And so, yeah, and I'll have various teachers come on and teach different classes, or, I'll collaborate with those different teachers to just offer whatever I feel like either the demographic needs, the professional voice demographic needs, or if it's just something that I'm really interested in exploring. Sometimes it fails, sometimes it's a great success.
Yeah. Okay, cool. And one other thing I noted in your bio, I saw, and I went down this, well, I only went a little bit down the rabbit hole, but I saw that you are the head of research and an advisory board member for something called the Academy of Noise. And I didn't know what that was. So I looked it up and I saw that it's a beatbox academy. And I thought, wow, what a cool, beatboxing is such a wonderful art form and vocal form. So tell us just a little bit about what's the Academy of Noise, and how is your research supporting that?
Yeah. Oh, thank you. That is so sweet of you. Academy Noise, it's awesome. I work with two of the most high elite world champion beatboxers, Kayla Mulady and Mark Martin. And then a colleague of mine who's a speech therapist, Tom Burke, is also on the advisory board with me. And then we've been collecting research with NYU, with Aaron Johnson at the New York, at NYU Voice Center. And so we've done endoscopies of 8 beatboxers. So scoping and watching them beatbox while we're looking at the vocal cords and the vocal apparatus.
Wow.
And then we've brought Kayla and Mark in to do some MRI imaging. So we have 2 parts to the research that we're doing. We have one, we're sending out we're already in the process for this one, where we've sent out information to 100 beatboxers to see if there's nomenclature of sound. So like, what do you call this? What's the name? Like
a vocabulary for
consistent language. Yeah.
Totally. Interesting. Yeah.
Because a lot of times it's like, I don't know, how are you doing that sound? It's like, I don't know how I'm doing that sound. What do you call that sound? So one, is there a language among that art form? And then the second is to figure out the function. I mean, we brought in 8 different beatboxers, asking them to do the same 50 sounds.
Right.
And I can tell you right now that they were not creating those sounds in the same way.
Same way. Yeah. Interesting. Yeah.
So it's like, okay, you're calling the sound, like, are you calling it the same thing? And if so, are you doing it the same way?
Right.
And can we gain information for that? And so that's all exciting information and research, but the Academy of Noise is bringing beatbox and the art form to speech therapy. So that's a matter of the idea, especially when working with young kiddos. So when you have young kiddos and they're having to go to, therapy session after therapy session after therapy session, and they're kind of getting the idea that like something's wrong with me. Beatbox can be a wonderful way to get into the articulation, get into various resonation, get into what a speech therapist is working with by using beat sounds. And so the idea with Academy of Noise, what Kayla and Mark's mission, I think their life mission, and this, I am not involved in this part. This is them. But I am they're very good friends of mine, and I'm such a huge support of what they're doing and their mission of including can we make this really fun for someone that they want to create these sounds, and how can we implement that into speech therapy? And they've worked in intercity schools, and the shy kid who's in the corner who doesn't want to participate in anything, by the end is like right up in the middle of the whole thing. So they're changing. I mean, and it's the community of being able to kind of speak that language of beatbox. It gives kids, it gives them confidence, a confidence that many other things haven't given them. So I believe in that project so much, and I'm grateful to be a part of it.
So cool. So can we include a sample of you beatboxing as our kind of closing remarks here?
Oh my gosh, I should play a video of them because they are like the worst. So they teach, they say everyone can do it. So they teach like boots, cats, either puppy or puppet, cats. So it's like boots, cats, puppets, cats. Okay, so it's like I'm terrible at beatboxing, but that's how they first initially start someone to do it.
I'm feeling it. That's the beginning. That's awesome.
Yeah, my
Yeah.
husband learned how to beatbox so well from them, and has performed as a beatboxer. But I have not. I've never performed as a beatboxer, but I haven't studied it so much. But please, YouTube Mark Martin and Kayla Mulady. You will hear some of the most unbelievable sounds. Like,
all right, we'll put some links. We'll put some links. Yeah,
beatboxing is,
can be.
Wow, it's extraordinary. Yeah,
super cool. Well, anything so wonderful. This feels like an excellent glimpse into the world of your world with vocal work. Is there anything you think that in terms of a closing remark, have we missed anything? Is there something we should know about anything upcoming for you? What else?
I mean, if you're interested in learning movement, we have a level 1 and a level 2 seminar in Orlando, Florida, coming up with PMR, with Performance Movement Restoration.
Yep.
And you can check out the PMReducation.com to learn more there. We have 10-week online programs if someone's interested in that. You could always check out my podcast at the Visceral Voice, and you could check out the visceralvoice.com if you're interested in any kind of self-paced class, my self-care class. I think.
Great. Yeah, we'll make sure people know how to find all of this in our show notes. Great. Well, Christine, thank you so much for taking time just to give this whole overview.
Oh my gosh, my pleasure. Thanks for having me on. I always love just geeking out and talking with you, Alex. So I appreciate it.
Awesome. Thank you. Thanks for listening to today's episode of the Red Beard Embodiment Podcast. To learn more, visit us at redbeardsomatictherapy.com or send me an email at alex@redbeardsomatictherapy.com. If today's conversation resonated with you, help spread the word by subscribing and sharing with others. Hope to see you next time.